UNC from a learning and a training standpoint is really special. Being that we take care of anyone from the state, we see a wide range of pathologies and a wide range of patient types, whether that's demographics or insurance status, even immigration status. We take care of everyone here. I'm really proud of the fact that this institution takes care of everyone and helps them navigate from day one.
What made me decide that I wanted to do fellowship at UNC was really a gut feel, honestly. We have really outstanding divisions across and departments across the School of Medicine, as well as schools of public health, nursing, and pharmacy that are all at the top of their fields. There's really endless opportunities for collaboration.
Chapel Hill is a wonderful place to live. I think that it's unique in that it has kind of the best of both worlds, where it definitely can have the small town feel. There's not very much traffic, only takes me 15 minutes to get to work in the morning. Everyone's lovely and friendly and easy to interact with, but it also has a lot of the things that you would want out of a big city.
We're very proud of our fellows and of the heritage we have, and I do feel like you're able to make sure that you expand quality care to patients, not just here that we will actually be able to see and take care of, but to people around the country. So you feel like in a small way you're helping perpetuate and improve GYN oncology care.
A number of years ago, we really wanted to double down on our ability to support fellows and trainees as they were going through their research years. We wanted to have our own version of a training program for trainees interested in clinical and translational research, meaning kind of the human subjects research, be it tissue-based, looking at what's happening in a lung cancer under the microscope or the genes of it, all the way through to clinical trials. And to be honest, teaching those that are more clinically oriented the tools of the trade for laboratory scientists working with tissue-based studies, and vice versa. And it supports several trainees per year in doing what we consider to be bench-to-bedside research. And to be honest, unless the bench and the bedside are talking to each other, not much gets done.
At UNC, it's a 3-year program, and it's 2 clinical years, which are year 1 and 3, and then it's the research year is in the middle. Most folks actually come to my lab. I run a translational research lab that's NIH funded. I started as an attending in 2007, so we've been funded for all that time, which I'm proud to say. Certainly we have a huge, amazing cancer center, so if there was something that our fellows wanted to do outside of my lab, that could be a possibility as well. Many, many options, although I will say that most fellows come to my lab because I do love having the fellows hang out with me for a special year to learn about research.
Definitely having that experience in lab has allowed me to be able to read a basic science paper in a more thoughtful way and even in a more critical way than I wouldn't have before being in the lab.
Our trainees are the future in terms of leadership in addition to expertise. And I think UNC has long led cancer research and cancer care. And I think we intend for our trainees to learn how to lead. And that's what we really want to invest in our trainees and learning how to do, because then you can take advantage of so much here.